Hello there. My name is Dr. Dennis Mihalatos, and I'm the Director of Echocardiography at St. Francis Hospital in Roslyn, New York.
I'm Bob Biederman, cardiologist at Allegheny General in Pittsburgh, Pennsylvania, where I'm the Director of the Cardiac MRI program. So this is a case I've entitled All That Glitters Is Not Gold. It's our 62-year-old female with a long history of coronary disease, bypass. She's had an ICD, progressive shortness of breath, some dyspnea exertion, and now presents with amaurosis fugax, so monocular blindness in one eye. She's admitted into the neuro ICU, and as usual, an echocardiogram is performed. There's nothing good about this echo here. We see lots of things. One, she has an ischemic cardiomyopathy. She's got LV dysfunction, ejection fraction is well less than 10%. The apex and the lateral and the anterior wall, apical walls are unclear. And more importantly, there is signs of additional problems where she has spontaneous echo contrast, where there's slow-moving blood flow, which is the milieu for thrombus formation. We cannot resolve the apex, the anterior wall, part of the inferior septum, and the spontaneous echo contrast is one of the better cases of such that I have seen. And there's some bizarre or not so clear loss of the typical apical trabecular pattern with a small amount of projections into the chamber. But I do want to point out that in one of these images here, that just out of the corner of her eye, we can see a large mass protrude in and out of the heart. We did some additional imaging, and I simply show this as part of the complete study, that you can see that she's had an ICD. You can see something mobile on the ICD, probably a small vegetation, and torrential tricuspid regurgitation or near torrential tricuspid regurgitation. So unquestionably, she has wall motion abnormalities. We're unable to see multiple segments, so she needed to undergo a DEFINITY examination, and DEFINITY was performed. And I think it's very clear here that in fact that mass is a large space-occupying apical mass. Wall motions are hypokinetic, akinetic, and more clarified, and there is not just one mass, but there's two masses, and the masses are rather large, space-occupying, and mobile. And now we see this mass rather substantially in a way that, whether we're on axis, off axis getting it, there's unmistakable clarity that this is most likely a thrombus. Although it is so large, it begs the question, could this be a thrombus? So we decided she needed to have further evaluation. She had a second, on that same day, transient monocular blindness of the second eye. She started having necrotic areas on her tongue. She had mesenteric ischemic signs and symptoms, and showering of embolic phenomena. Took her right to the operating room that day. Bypass, took this mass out, and not so surprising, the mass turned out to be a thrombus, not a big surprise. But what was very interesting is that the histology there suggested it was of greater than 10 years duration. And then there was evidence of this early vascularization of thrombus with neovascularization, something that we had reported a number of years ago, that chronic thrombi over time can take up contrast or become vascularized. And if you look back at those DEFINITY images, in addition to getting information about left ventricular wall motion, akinesia, dysfunction, you can see some other subtle signs that there may be a hint of uptake of that DEFINITY. In later discussions with her, she told me, and I quote, that, you know, Doc, I just got weary of taking my Coumadin the last 10 years. Everything was fine, and I stopped it about 4 or 5 weeks ago. So a very nice case that sort of puts things into some perspective, gives us information about endocardial function, motion of the mass, and maybe a hint about the pathology of that mass as well.
Another good example of how DEFINITY can affect patient management.
Let's review the important safety information for DEFINITY. DEFINITY Vial 4 Perflutrin Lipid Microsphere Injectable Suspension. Indications: Activated DEFINITY perfluorine lipid microsphere injectable suspension is indicated for use in patients with suboptimal echocardiograms to opacify the left ventricular chamber and to improve the delineation of the left ventricular endocardial border. Contraindications. Do not administer DEFINITY to patients with known or suspected hypersensitivity to perfluorine lipid microsphere or its components, such as polyethylene glycol, PEG. Important safety information. Warning. Serious cardiopulmonary reactions, including fatalities, have occurred uncommonly during or following perfluorine-containing microsphere administration. See Warnings and Precautions 5.1. Most serious reactions occur within 30 minutes of administration. Assess all patients for the presence of any condition that precludes DEFINITY administration. See Contraindications 4. Always have resuscitation equipment and trained personnel readily available. In post-marketing use, rare but serious cardiopulmonary or hypersensitivity reactions have been reported during or shortly following perfluorine and PEG-containing microsphere administration. See Adverse Reactions 6. The risk for these reactions may be increased among patients with unstable cardiopulmonary conditions and/or with pre-existing PEG hypersensitivity. See Adverse Reactions 6.2. It is not always possible to reliably establish a causal relationship to drug exposure due to the presence of underlying conditions. Please see full prescribing information, including boxed warning, regarding serious cardiopulmonary reactions. Full prescribing information is available at definityimaging.com from a Lantheus sales representative or by contacting Lantheus customer service at 1-800-299-3431.